Long-term patient-related outcome measures of septoplasty, a systematic review. Eur Arch Otorhinolaryngol. 2018 Jan 13. Authors, Tsang CLN, Nguyen T, Sivesind T, Cervin A. Abstract. Purpose: septoplasty is a common rhinological procedure intended to relieve symptoms of chronic nasal obstruction. However, there remains a question as to whether patients obtain symptom improvement and are satisfied with surgical outcomes in the months and years after septoplasty. This review aims to evaluate the long-term efficacy of functional septoplasty for nasal septal deviation. Methods: a systematic review of the literature was conducted from November 2014 to March 2016 using the Cochrane, EMBASE, and PubMed databases. Prospective trials concerning functional septoplasty, which assessed subjective outcomes and included long-term follow-up data, greater than or equal to 9-month post-septoplasty, were included. Results: 2,189 articles were screened with 7 meeting the criteria for inclusion. Patient satisfaction was assessed in 6 studies, with rates of satisfaction provided in 3 of these, ranging from 69 to 100%. 2 studies assessed the degree of patient satisfaction, with 1 study indicating that 88% of patients were moderately satisfied or better at 1 year post-op, and the other reporting that 50% of patients were satisfied. In assessing symptom relief, several methods were used, including validated questionnaires, with varying degrees of improvement in nasal obstruction reported. Conclusions: septoplasty appears to be a far from perfect treatment for nasal obstruction due to septal deviation. However, given the heterogeneity of data and lack of randomized controlled trials, RCTs, future RCTs and use of validated questionnaires would enable generation of superior levels of evidence. We suggest future prospective trials evaluating prognostic factors in septoplasty, to better inform patients and facilitate the development of guidelines for surgical intervention. PubMed, 29,332,171.